Hi, I'm Dr. Heather Young with Pediatric Infectious Diseases and Occupational Health here at Arkansas Children's. We have for you today a video that was produced by our partners over at UAMS. It's featuring my colleague, Dr. Ryan Dare, and he's discussing how we can best protect ourselves and use our PPE appropriately as we navigate this challenging time during COVID-19. Please continue to take care of each other and be safe.
Hello, my name is Ryan Dare, and I'm one of the infectious disease physicians here at UAMS. And I'm here to discuss our recent changes in our isolation policies for patients with suspected or proven COVID-19 infection. We've recently moved from airborne isolation, which would be N95 and cappers, to surgical mask isolation for proven or suspected cases. And I want to discuss the reasons. COVID-19 is a coronavirus, which we've all been exposed to and seen for years, and we have very good evidence that droplet isolation protects against coronavirus infections. Though there haven't been studies performed yet to determine if droplet versus airborne isolation is better to prevent infection, we have a lot of evidence to suggest that droplet isolation is sufficient to protect our healthcare workers and patients from further spread of the infection. The WHO recommends that for patients either suspected or proven COVID-19 infections, should wear surgical masks unless they're undergoing a aerosolization procedure, such as intubation, bronchoscopy, or tracheal aspiration. Common exposures like being around a patient with cough or performing a nasopharyngeal swab does not qualify as an aerosolization procedure, so a surgical mask would be fine. We've reached out to other institutions that have the same policy as surgical mask and droplet precaution for proven or suspected cases in the absence of aerosolization procedures. The main one being University of Washington, which has had probably the most cases in the United States so far. Their procedure of surgical mask has not resulted in an increased number of healthcare worker infections, and in fact, they state that their rate of infections in their healthcare workers, despite their high risk of being in the hospital every day, are lower than in the community in Washington. So I want to just reassure everybody that we are not changing the policy for isolation because we don't have the resources. In fact, we have plenty of N95 masks at UAMS right now. The change in policy is because this is what is practical and makes sense and will keep our healthcare workers safe. This is a fluid situation and things may change over time, but we want to reassure you that we are here to protect our healthcare workers and support the safety of everybody here at UAMS. Thank you.